And we are live. It's 9 at 9 on Wednesday night. Although it's 9 at 6 if you're on the West Coast and 9 at whatever time it is wherever you are. We are excited to be joined tonight by Dr. Paul Nassif, known to all, who's going to come speak with me about all the things that are happening in facial aesthetics. He's been a long time colleague and friend, and we're looking forward to having him share some of his thoughts on what's trending in plastic surgery and facial plastic surgery and other things. Hey.
What's happening, my brother?
Good to see you. Thanks for jumping on with us tonight.
Well, let's start about our fun lips and nose convo.
Yeah, absolutely. So lip lifts. Let's talk. Lip lifts have been trending for a little while now. What's happening out your way with lips?
Well, let me tell you right now, the biggest thing that's happening now that I've seen kind of explosion in, besides the usual, is lip lifts. And this young man you're speaking to, Dr. Spiegel, years ago was saying, Paul, I do lip lifts at the same time as rhinoplasty. And I said, what? You got to be kidding me, because, we're worried about the blood supply, because the rhinoplasty incision goes right here in the columella, and then the bullhorn lip goes right around all the way.
Exactly.
And he goes, yeah, I also do it on with weir incisions. Those are alar base reductions, where you're taking a piece of tissue, a pie wedge here and here. So imagine doing nostril reduction, nose job, lip lift. And so since I had the conversation with Dr. Spiegel many years ago, I've been doing that also. So that's what we're doing a lot of, especially with facelifts and noses. We're doing a lot more of those.
Yeah, I remember talking to people at conferences and saying, everybody's facelifts are looking great, but when you miss the lip lift, it's not done. It's sort of it gives you that incomplete, partially done look, and that's when people used to look fake. People would say that person had a bad facelift, and I look at the result and say, they had a good facelift. They just didn't do everything. It's like saying I fixed the counter in the kitchen, but you left the old cabinets or old appliances. It's not done. When you do these together, how often are you doing that? Is this something that's a common thing? You're doing this daily, weekly?
Not daily, because remember, my practice, the way it works is about 60% is rhinoplasty and about 40% is nose. No, I'm sorry. 60% rhinoplasty, 40% aging face. And that's facelifts and eyes and brows and everything else. And,
sure.
So I would say mostly with the facelifts. And then I would say maybe once a week, we're doing a lip with the nose.
Yeah, and the key is, of course, the age of the patient, right? So if you're doing somebody who's a young girl, 17, 18, 20 years old, she may not need the lip lift.
I actually am really conservative about that. I personally really, when it comes to the involutional or aging lip, and that's the time for me when I think a lip lift, because you are getting a permanent scar no matter what. And by the way, a friend of mine, the famous David Damas, just went on and said, hello, David. Got to say hi to my brother there.
Oh, very nice.
So, yes, so that's something. But listen, you've been doing this for years, and especially you do a lot of surgery for, SRS surgery. And that's...
one of the things I think on lip lifts, which you probably are seeing too, is people will come in and they have a horizontal crease on their upper lip. When you see that, that's almost pathognomonic of saying this person needs a lip lift, because they're struggling to hold their lip up.
Absolutely. It's interesting. A lot of patients come in following a rhinoplasty. And especially when you put what we call a septal extension graft or things like that or what we call a columella strut, something in the nose to solidify it, then you see that line more. And the funny thing is, about 4 years ago, I learned from one of the lecturers I was listening to, maybe it was you, that you need a lip lift exactly in that situation.
Yeah, that's exactly right. And the other thing about it is that when people get their nose rotated, people come in with that ptotic tip, you rotate the nose up, even if you didn't move the columellar base at all of a sudden they're seeing their lip. Whereas before it was sort of the focus was the nose,
Yes.
and they didn't even realize
Yes.
it.
So now what you're happening there when you see that, obviously when you rotate the nose up, you're seeing the real distance between the what we call the subnasale, the top part between the nose, it's the lip, and the upper lip. And that's when these patients come in where they need a lip. But again, one thing you and I do is we're careful. We measure, beforehand, do they have enough lip to remove or the skin to
Right.
remove?
That's exactly right. And some people will want a lip lift because they're not seeing a ton of tooth show, when in reality they just have short teeth. So it's a whole combination of considerations in that area. Now you mentioned that you do, close to half of your practice is of course aging face as well. Talk to me about buccal fat. You seeing a lot of that you're doing? That's another thing I've been doing for years.
Yeah, I know. I have to tell you, it's interesting, especially when a celebrity gets on board and does it, however he wants to jump and do it. And I've been very conservative about that myself. And especially with the right patient that has a really full volume right here, that's fine. But here's the issue. To me, in my mind, I'm careful because I know that as they age, that area will get very hollow. So I'm a little conservative on that. I'll do that selectively. Why, you're doing it a lot? Talk to me
Well,
about
yeah,
it.
we do it frequently, but also selectively. And I think it comes down to what a person looks like in the beginning. Out your way, you're going to see more people who are already very fit and taut in the face, and they want it because, someone on TV did it. I'm seeing a lot of people who have very full cheeks right here. And when we take that away, it becomes much more normal. It's not sunken in. And then as they age, I think it stays proportional. Of course, we all lose fat as we age. And as I tell people, it's pretty easy for us to add volume back to places. That's no big deal. We got a lot of ways of doing that.
What is your average age you'd say with that?
Average age for buccal fat removal is going to be 20s and early 30s.
Wow. Okay.
Yeah.
So, something you're doing more of it than I am. And again, we're getting these young ladies that come in that you're right, that want that done because they see it on Instagram. And I will, I do shy away from that, especially when they're that young. But listen, this is something that there's certain things that you do a lot, especially with your facial feminization surgery. And obviously, that's something that you know about. So the thing is, buccal fat's in, like you said, removal, lip lifts together with rhinoplasty, lip lifts together with facelifts. And to me, what I do like doing when I'm doing a buccal fat removal, I love doing it through a facelift incision.
Through the deep
do
plane.
a deep, we both do deep plane and neck lifts, and that's to me is still a fantastic way to go.
Yeah, I agree with that. In fact, if you're coming to one of the next meetings, and I know you were the chair of a meeting that I worked with you on, we were both kind of the co-directors last May, but the next one that's coming up is going to be here in Boston, and I hope I'm allowed to say this. We're going to be presenting a paper talking about the subunits of the cheek and how, every sort of half an inch changes the diagnosis and changes what you have to do. And people will come see us saying, I don't like my cheeks, but it's a very specific thing that you need to address. So we're almost out of time, but talk to me about skincare and the Dr. Nassif skincare line, and how'd you start doing that? And
Absolutely correct. I started getting into skincare, and usually most facial plastic surgeons are not going to be doing this. But I will start telling you, I started loving exfoliation and hydration. Yeah, I started noticing actually better results with a lot of hydration. And again, that's after my surgery because, when you have the neck that has all the wrinkles still after the swelling goes down and the discoloration, the lack of tone, firmness, and texture is off, I started really getting into skincare about 12 years ago. So we presented about 5 or 6 years ago. I started on Home Shopping Network, and then I kind of became global with it. It's called Nassif, and you can see the website. It's nassifmdskincare.com. And we have, an Instagram for it, and, it's something that is become extremely exciting for me because we sell everywhere and on different markets in Canada and UK, throughout Europe, now the Middle East, of course, United States. And it's something that I love doing. And basically the precepts of my brand are exfoliation, nourishment, protection of the skin, and hydration. So everything I do is focused on those.
That's excellent. And, I'll just say that these things really work. It's not instantaneous. Rhinoplasty is as close to an instantaneous change as you can get, because people, an hour or so later, they can see a picture of themselves at least, and the skincare takes a lot longer. But you absolutely need it. And what I tell our patients out here is you can build someone a beautiful house, but if they're not painting it and taking care of it, it's not going to look so good in a short period of time. And that skincare line is the maintenance. It's the daily care.
Well, that and SPF. And like what we
SPF.
On my website, I would say we have all, before and afters. And again, to get before and afters on these TV shoppings, they actually scrutinize it, and they have to have you go to a specific lab to do the photographs.
Wow.
They have to do everything. So it's not like you can just pick and choose who you want. But now I do want to announce something. Well, no, it's not we are filming season 8. It's not a great thing, but we were talking about SPF. When I was growing up, we didn't wear sunscreen. We did a lot of baby, because I'm a lot older than you, Jeff. I'm sure, I'm 60. And so I want you all to look at something. You see that, right?
I do. Right on your middle of your forehead.
You see that, right?
I see that one too.
So I just had those biopsy, and those are both basal cell carcinoma. So they're both skin cancers. And so I'm going to go have those treated in the next, probably next week. So that's why I tell everyone, you got to be careful and watch, you got to take care of your skin. I've already had skin cancer here, and I've had multiple reconstructions. So we're going to have one here and here. And now we're going to see what happens. This one is going to be treated with something called Mohs surgery, where the dermatologist removes it and looks at it under the microscope to make sure you're getting all of it. And then, we'll close it. This one, though, a good friend of mine who's it was the president of the Dermatology Society and stuff, he wants me to do something different. He doesn't want me to use the ointment called Uracil, fluorouracil, or some of these 5FU, which we use in injecting the tissue all the time, you and I do, especially the nose. And he doesn't want me to do Mohs yet on this. He actually wants to do, because he looked at the pathology, he wants to do CO2 laser on it, because it's superficial. He wants to use CO2. And I never thought about that, but he's been doing this for 35 years. So I'm going to try that. And then again, we'll look at it, maybe rebiopsy, and see how that goes. So that's going to be different versus doing about the size of probably a bigger nickel or even a small quarter. That'd be a pretty big little hole there.
Yeah. Well, you obviously have a large audience you reach, and when you share things like that, it's meaningful, because people get a chance to understand that you do have to get things checked out, and you do want to take care of things. So thanks for letting us know. We wish you the best.
Thank you. Make sure you all do routine skin checks with your dermatologist.
Absolutely. All right. Well, 9 minutes is long gone. Thank you once again for speaking with us. It's always a pleasure. And have a great evening. Enjoy the dinner that's being fixed up in your kitchen there, and best to your beautiful family. And we'll see you soon, I hope.
All right, my brother. Listen, you all take care. Everyone, take care. Dr. Spiegel, I'll be seeing you soon, my friend.
I look forward to it. Have a good night.